Thank you very much for letting me present this. So, VATS diaphragmatic plication. I declare I have no conflicts of interest. So VATS, stitching without a wrist, not tying, very challenging. How can you do this in a reproducible fashion, efficiently, and safely? So we started our program back in 2016. We had a couple of our cases. We looked at their demographics. We assessed their exercise tolerance pre and post-op, their spirometric values, and the X-ray changes in the vertical dimensions. We also tried to correlate between the changes in the X-ray dimensions and how well the patient improved with his exercise tolerance. As you can see here, the FEV1 improved significantly. The FVC improved statistically significantly. When we looked at the patient's exercise tolerance before and after the operation, there was a very, very good improvement. The vertical dimensions of the X-ray were also significantly better. When we correlated the change in the vertical dimension of the X-rays to the exercise tolerance of the patients, they correlated very nicely. Here, I just wanted to show you very briefly how simple it is. We use CO2 to push the diaphragm away. We use something called the endo stitch, but there are other stitches on the market. It allows you to take a very nice deep stitch, as you can see, without the need of a wrist at all. Very simple, very straightforward. Even though you can use knot tires, knot pushers, we tend to use the core knot, which saves a lot of time rather than knotting around 50 knots over the course of 10 stitches. It's just one per stitch. We usually use, on average, 8 to 10 horizontal mattresses. As you can see, the diaphragm here is very nicely tense. We put the pledgets intercorporeal, but you can put them extracorporeal as well. The diaphragm is very nice and very tense. This is the pre-op X-ray for that patient, and that's the post-op X-ray. You can appreciate the difference in the vertical dimension very well here. To conclude, VATS diaphragmatic plication is feasible with good to excellent spirometric, radiologic, and exercise improvements. There is a good correlation between your radiology and the exercise improvement. Thank you.